Epidemiology of osteoarthritis. Osteoarthritis is the most common form of arthritis, affecting over 300 million people worldwide. It is a degenerative joint disease that usually develops with age, especially after 50. It is rare before 40 but very common after 65. Women are more affected than men, especially after menopause, particularly with hand and knee osteoarthritis. Hip osteoarthritis, though, affects both sexes about equally. The main risk factors include aging, obesity, joint overuse or injury, genetics, and repetitive work or activities. Symptoms develop gradually and include joint pain that worsens with use, stiffness, and decreased range of motion. You might also see bony enlargement like Heberden's or Bouchard's.
Maria Lopez, a 64-year-old woman present with 1-year history of worsening bilateral knee pain. She also reports worst on the right knee and described as dull and activity related with brief morning stiffness and no systemic symptoms. Her physical examination reveals mild right knee swelling, crepitus, reduced range of motion, and the Heberden's nodes. Her laboratory results shows normal ESR, CRP, and negative rheumatoid markers. Her clinical findings are consistent with primary knee osteoarthritis, more severe on the right, but with no evidence of inflammatory or autoimmune diseases.
Diagnosis starts with a physical exam and history, but x-rays are key for showing cartilage loss, joint space narrowing, and bone spurs. There's no specific blood test for osteoarthritis, but labs can help rule out other conditions like rheumatoid arthritis or gout. Sometimes doctors do joint fluid analysis or even use arthroscopy to look directly inside the joint. For pathophysiology of osteoarthritis, osteoarthritis is a degenerative joint disease influenced by both modifiable risk factors like obesity, lack of physical activity, hypertension, and overuse of painkillers, and non-modifiable risk factors such as gender, sex, and genetics. These factors lead to joint stress and biochemical imbalances that damage chondrocytes, the cells responsible for maintaining cartilage. This triggers the release of pro-inflammatory cytokines like IL-1 and TNF-alpha, increasing enzymes called MMPs that degrade the cartilage. As cartilage breaks down, the joint loses proteoglycans and collagen, leading to changes in the underlying bone, including increased density, cysts, and bone spurs. These changes irritates the synovial membrane, causing low-grade inflammation, narrowing the joint space, and over time, this results in pain, stiffness, and reduced mobility, classic signs of osteoarthritis. Nursing diagnosis: chronic pain related to joint inflammation, cartilage deterioration, and decreased joint space. Impaired physical mobility related to joint stiffness, pain, or structural joint changes. Activity intolerance related to pain on movement, muscle weakness, and fatigue. Risk for falls related to impaired mobility, joint instability, and decreased muscle strength. Self-care deficit related to pain, joint stiffness, and limited mobility. And risk for impaired skin integrity related to decreased mobility and pressure on joints.
Management for osteoarthritis includes medication. Although there are no medication that can slow or stop the progression of osteoarthritis, some can minimize or relieve pain, so it can be more comfortable and active. And more activity can further reduce pain and improve fitness. Most medication used to ease osteoarthritis pain are taken by mouth, which include the following: analgesics. These are pain relievers and include acetaminophen and opioids. Acetaminophen is available over the counter or OTC, and opioids must be prescribed by a doctor. Non-steroidal anti-inflammatory drugs or NSAIDs include aspirin, ibuprofen, naproxen, and celecoxib, available either over the counter or by prescription. These drugs are the most commonly used to ease inflammation and pain. Counter-irritants. These are over-the-counter products contain ingredients like capsaicin, menthol, and lidocaine that irritate nerve endings so the painful area feels cold, warm, or itchy to take focus away from the actual pain. Corticosteroids. This prescription anti-inflammatory medicine work in a similar way to a hormone called cortisol. Platelet-rich plasma, available from a doctor by injection. This product is intended to help ease pain and inflammation. Other drugs include antidepressant, duloxetine, and anti-seizure drug pregabalin are oral medicines that are FDA approved to help treat osteoarthritis pain. Management for osteoarthritis also include non-drug therapies. Exercise. Movement is an essential part for an osteoarthritis treatment. Getting 150 minutes of moderate to vigorous exercise per week should be the goal. According to the U.S. Department of Health and Human Services, a good exercise program to help osteoarthritis pain and stiffness has 4 parts. First, strengthening exercise. This helps to build muscle around painful joints and help to ease the stress on them. Range of motion exercise or stretching helps to reduce stiffness and keep joints moving. Aerobic or cardio exercise help in improving stamina and energy levels and reduce excess weight. Balance exercise help to reduce or strengthen small muscles around the knees and ankles and also prevent falls. Non-drug therapy also include weight loss, physical therapy, and surgery. Weight loss because excess weight puts additional force and stress on weight-bearing joints, including the hips, knees, ankles, feet, and back, and fat cells promote inflammation. Physical therapies and assistive devices. Physical therapies, occupational therapies, and chiropractors can provide specific exercise to help stabilize your joints and ease pain. Information about natural treatments and products can ease pain. Instruction to make movement easier and to protect joints. Brace, shoes, inserts, or other assistive devices. Surgery include joint surgery and joint replacement surgery. Joint surgery can improve pain and function, while joint replacement surgery replaces damaged joint to restore mobility and relieve pain. Health promotive. Practicing these following habits can slow down osteoarthritis, keep healthier overall, and delay surgery as long as possible. It is important to pursue a number of different self-care approaches simultaneously. Maintain a healthy weight. Combine healthy eating and regular exercise to maintain a healthy weight. Control blood sugar. Having diabetes causes inflammation, which also weakens cartilage. Maintain range of motion. Gentle stretching, raising, and lowering legs from standing or seated position. Daily walks and habits such as gardening can help. Protect joints. Make sure to warm up and cool down when doing exercise. Relax. Find ways to reduce or avoid stress through meditation, listening to music, connecting with friends and families, doing fun activities, and finding ways to relax and recharge. Choose a healthy lifestyle. Eating healthy food, balanced nutrition, not smoking, drinking in moderation, and getting good sleep will help feel better. Disease preventive for osteoarthritis includes the following. Control weight. Maintaining healthy weight may be the most important thing to do to prevent osteoarthritis. Exercise. If the muscle that run along the fourth of thigh are weak, research show that it is related with the increased risk for painful knee osteoarthritis. Avoid injuries or get them treated. Suffering a joint injury when a person is young predisposes to osteoarthritis in the same joint when they get older. Eat right. Although no specific diet has been shown to prevent osteoarthritis, certain nutrients can have associated with a reduced risk of the disease or its severity. It includes omega-3 fatty acids and vitamin D. Curative and restorative care for osteoarthritis focuses on relieving symptoms, improving joint function, and enhancing the quality of life. Since osteoarthritis is a chronic degenerative condition with no current cure, treatment is aimed at managing the disease and restoring its function as much as possible. Medication includes analgesic, NSAIDs, counter-irritants, corticosteroids, and platelet-rich plasma. Other pain-relieving therapies. Beyond medication and exercise, a number of different therapies are available that may help to prevent osteoarthritis pain. Hot and cold treatment. Heat in the form of heating pad or warm bath improves blood flow and eases joint stiffness. Using cold packs reduces pain and swelling. Relaxation techniques. Techniques such as deep breathing, guided imagery, and visualization relax tight muscle and relieve pain. Acupuncture. Acupuncture has shown to help relieve osteoarthritis pain. Massages, rubbing and kneading of muscle and joints. Braces, splints, and orthotic devices. Devices such as braces and splints may be helpful for relieving joint pain and shifting weight away from the damaged area of the joint, reducing pressure on the joint and relieving swelling by compression. Radiofrequency ablation, or RFA, is a procedure in which the doctor inserts needle guided by X-ray into a painful area of the arthritic joint, and then passes a current through the needles and to ablate or burn the nerve ending to relieve pain. Having a healthy lifestyle includes stop smoking. Some research suggests that the people who smoke may have more cartilage loss and pain than those who don't. Smoking also interferes with the healing and joint surgery. Use of self-help devices. If osteoarthritis makes it difficult to do daily activities, ask occupational therapists about self-help devices that can make daily tasks easier. Seek emotional wellness. Pain and limited mobility can lead to anxiety and sadness. However, learning to cope with it improves mood and eases worries. Communicate with friends and families. Ask for help when needed and let people in the patient's lives know that when they were not able to do the activities. Eat well. There are no specific diet for osteoarthritis. However, eating a diet rich in vegetable, fruit, fish, and healthy fats like olive oil will help improve overall healthy lifestyle. Surgeries includes joint surgery and joint replacement surgery. Determination and management of cause of osteoarthritis. Factors may contribute to the development of osteoarthritis include age. The risk for developing osteoarthritis increases with age and symptoms generally but not always appear in people over 50 years old. Joint surgery. A bone fracture or cartilage or ligament tear can lead to osteoarthritis, sometimes more quickly than in cases where there is not obvious injury. Overuse. Using same joints over and over in a job or sport can result in osteoarthritis. Obesity. Excess weight adds stress and pressure on joint. Plus, fat cells promote inflammation. Musculoskeletal abnormalities. Malalignment of joints or bone structures can contribute to faster development of osteoarthritis. Weak muscle. If muscle don't provide adequate joint support, poor ligament can result in which can lead to osteoarthritis. Genetics. People with family members who have arthritis are more likely to develop it. Gender. Women are more likely to develop osteoarthritis than men. Environmental factors. Modifiable environmental risk factors include things like someone's occupation, level of physical activity, quadriceps strength, presence or absence of prior joint injury, obesity, diet, sex hormones, and bone density. Management includes medication like analgesic, NSAIDs, counter-irritants, corticosteroid, platelet-rich plasma, and non-drug therapies like exercise, weight loss, physical therapies and assistive devices, and surgery that includes joint surgery and joint replacement surgery.
Arthritis drug therapy, we have the first-line medications like acetaminophen, often recommended for mild to moderate pain, generally well tolerated with a low risk of side effect. Effectiveness may be limited in some patients. And we also have the topical NSAIDs, useful for knee or hand osteoarthritis. Lower systemic absorption reduces the risk of side effects compared to oral NSAIDs. For prevention of infection, maintain a healthy weight, engage in regular low-impact exercise, avoid joint overuse, ensure proper nutrition, and protect joints from injury. For the supportive management, it is important to have a regular exercise, weight management, special device and footwear, and some people with knee osteoarthritis try heat or cold packs, taping the joints, wearing bracelet, using shoes in soles that adjust how you stand and walk. For the immobility percussion, avoid prolonged inactivity, joint protection techniques, fall prevention, and regular monitoring. Prevention of complications. Avoiding joint injury or overuse, a sport injury prevention program may help. Having rehabilitation for knee injury and maintaining a healthy weight by eating a healthy diet and exercise. Rehabilitations focuses on pain reduction, joint mobility, and functional improvement. It includes exercise therapy, strengthening, aerobic, and flexibility exercise, physical and occupational therapy for joint protection and activity modifications. Pain management includes heat and cold therapy, TENS, and medications. And also, weight management reduces stress on weight-bearing joints, assistive device, brace, canes, or orthotics to improve mobility, education on self-medication, and joint care.
Epidemiology of rheumatoid arthritis. Rheumatoid arthritis affects 0.5 to 1% of the global population, making it less common than osteoarthritis but often seen in developed countries. It usually starts between the ages of 30 to 50, but it can affect any age like children. That is called juvenile idiopathic arthritis. Rheumatoid arthritis is 3 times more common in women than men, likely due to hormonal factors, and unlike osteoarthritis, rheumatoid arthritis often has an insidious onset, developing slowly over weeks or months, though it can sometimes appear more suddenly. Risk factors are genetics, especially HLA, DR4, and DR1. Other risk factors are sex, smoking, environmental exposures like silica, and possibly viral infections like Epstein-Barr virus.
A 42-year-old woman present with a 6-month history of progressive joint pain and morning stiffness lasting over an hour, affecting her wrist, MCP, and PIP joints bilaterally. So she also reports fatigue and occasional low-grade fevers. Her physical examination reveals joint swelling, warmth, and tenderness with early ulnar deviation and mild knee effusion. Her laboratory results shows elevated ESR and CRP with high titer RF that is strongly positive anti-CCP and mild normocytic anemia. ANA is negative and the findings are consistent with early stage seropositive rheumatoid arthritis.
While there's no single test that confirms rheumatoid arthritis, certain blood markers can support the diagnosis, like rheumatoid factor is positive in about 70 to 80% of cases, but it's not exclusive to rheumatoid arthritis. Anti-CCP antibodies are more specific to rheumatoid arthritis and may show up even before the symptoms. Inflammatory markers like ESR and CRP are usually elevated, showing active disease. And a CBC might show anemia, which is common in rheumatoid arthritis. For pathophysiology of rheumatoid arthritis is a autoimmune disease influenced by modifiable and non-modifiable risk factors. For modifiable risk factors, it includes obesity, poor joint protection, and a sedentary lifestyle, while in non-modifiable risk factors, it includes age, sex, family history, and seropositive status. Genetic susceptibility combined with environmental triggers activates the immune system. This leads to the activation of CD4 plus T cells and B cells, causing synovial inflammation. Immune cells infiltrate the joint and release cytokines like TNF-alpha, IL-1, and IL-6. This results in pannus formation, a thickened layer of inflammatory tissues that invades cartilage and bone. Over time, this causes joint destruction, bone erosion, and ultimately the deformities and loss of function seen in rheumatoid arthritis. Nursing diagnosis: chronic pain related to inflammatory process in joints, impaired physical mobility related to joint pain, deformity and muscle stiffness, self-care deficit related to joint deformity, stiffness, and fatigue, fatigue related to chronic inflammation, anemia, and disease process, risk for infection related to immunosuppressive therapy, disturbed body image related to joint deformities and functional limitations, and ineffective coping related to chronic disease, pain, and lifestyle changes.
The goal of management in rheumatoid arthritis is to get the inflammation under control. Medication include the following: NSAIDs or non-steroidal anti-inflammatory drugs can relieve pain and ease swelling and irritation. Side effects for all NSAIDs may include stomach upset, heart problems, and kidney damage. Steroids or corticosteroids medicines such as prednisone ease inflammation and pain and slow joint damage. The risk of side effects rises when taken at a high dosage over a long time. Conventional DMARDs or disease-modifying anti-rheumatic disease. These drugs can slow the progression of rheumatoid arthritis and save joints and other tissues from long-term damage. Biologic agents, also known as biologic response modifiers, often work best when used with conventional DMARDs such as methotrexate. Target synthetic DMARDs. Healthcare professionals may prescribe this human-made medicine if conventional DMARDs and biologics haven't worked. Janus kinase or JK inhibitors used to tamp down the immune system, ease inflammation, and prevent joint damage. A physical or occupational therapist can teach exercises to help keep the joints moving. The therapist may also suggest ways to daily tasks that are easier on joints. Assistive devices can also make it easier from stressing painful joints. Better medicines to treat rheumatoid arthritis have lowered the need for surgery. But if medicines fail to prevent or slow joint damage, the healthcare professional may think about surgery for damaged joints. Rheumatoid arthritis surgery may involve replacing or repairing damaged joint. The type of surgery will depend on the joint involvement. Surgery may help to use joint again. It can also help to ease pain. Health promotive include the following. Healthy eating. A balanced, nutritious diet consisting of recommended amounts of all the food groups help promote wellness and makes it easier to maintain healthy weight. Daily movement. Even when you don't have time to exercise, try to make movement as part of everyday routine. Balancing activity with rest. It is important to try and stay physically active even when flare-up comes, but rest is also especially important when rheumatoid arthritis is active and joints feel painful or swollen and stiff. Hot and cold treatments. Heat treatments tend to work best for soothing stiff joints and tight muscle, while cold is best for acute pain and swollen joints. Topical products. These creams, gels, or stick-on patches can ease the pain in joint or muscle. Stress reduction and complementary therapies. They are different ways to relax and stop focusing on pain. They include meditation, deep breathing, massages, and acupuncture. Supplements. Studies show that curcumin or turmeric and omega-3 fish oil supplements may help with rheumatoid arthritis and morning sickness. Positive attitude and support system. Cultivate a network of friends, family members, and co-workers who can help provide emotional support. Disease preventive in rheumatoid arthritis include the following. Don't smoke. Smoking is formidable adversary in the battle against rheumatoid arthritis. Eat a balanced diet. Nutritious food can help reduce inflammation, a key culprit in rheumatoid arthritis, and support overall joint health. Exercise regularly. Regular exercise enhances joint flexibility, strengthens muscles, supporting the joints, and reduces overall inflammation, alleviating symptoms. Avoid high salt in diet. Excessive salt intake can exacerbate rheumatoid arthritis symptoms by promoting inflammation and fluid retention. Add more fish and omega-3 to diet. Omega-3 fatty acids prevalent in fish are known for their anti-inflammatory properties, which can be particularly beneficial for rheumatoid arthritis. Next is to cut down sugar-sweetened soft drinks. High consumption of sugar-sweetened soft drinks can exacerbate rheumatoid arthritis symptoms. Moderate alcohol consumption. While moderate consumption may have some anti-inflammatory effects, excessive alcohol can exacerbate rheumatoid arthritis symptoms and interfere with medications. Next is to avoid environmental exposures, notably the interaction between genetic predisposition such as HLA or human leukocyte antigen gene and environmental pollutants like dioxin and cigarette smoke can significantly increase the risk for developing rheumatoid arthritis. Look after your teeth. Poor dental hygiene can lead to periodontal disease, which is associated with an increased risk for developing rheumatoid arthritis. Optimize vitamin D intake. Vitamin D is essential for bone health and has anti-inflammatory properties, which can help alleviate rheumatoid arthritis symptoms. Manage stress. Stress management is vital yet often overlooked. And lastly is to take early action. Rheumatoid arthritis is a chronic progressive condition notorious for leading a significant joint damage if left unchecked. Rheumatoid arthritis is not curable, but early and aggressive treatment can lead to remission. Curative in its context refer to strategies aiming for disease control or remission. The medications include NSAIDs, steroids, conventional DMARDs, biologic agents, target synthetic DMARDs, and JAK inhibitors. Restorative care focuses on rehabilitation, preserving mobility, and improving quality of life. This includes the following: physical therapy, exercise to maintain joint flexibility and muscle strength; occupational therapy, adaptive devices and techniques to assist daily activities; surgery includes joint replacement or repair of severely damaged joint; and lifestyle modification, which include regular exercise, maintaining a healthy diet, smoking cessation, and stress management. For determination and management of rheumatoid arthritis cause, rheumatoid arthritis is one of the most common autoimmune arthritis types. It occurs when the immune system malfunctions and attacks healthy tissues. is also a type of inflammatory arthritis. Inflammation is a central characteristic of rheumatoid arthritis, leading to pain and swelling that affects the joints and other body tissues. Inflammation is how body responds to defend itself from foreign invaders like bacteria and germs. In people with rheumatoid arthritis, the body's inflammatory response is overactive. Left unchecked, rheumatoid arthritis inflammation can lead to severe joint damage, disability, and disease complications. There are no cure for rheumatoid arthritis, but the disease is treatable and manageable. Medications used alone or in combination to treat condition include NSAIDs, corticosteroids, traditional disease-modifying anti-rheumatic drugs or NSAIDs, biologic DMARDs, JAK inhibitors, and target synthetic DMARDs. People with rheumatoid arthritis will experience periods where their disease flare-ups. These are times when their symptoms are worse. Some at-home remedies for managing flare-ups of rheumatoid arthritis includes cold and heat therapies. It can relieve pain using ice pack on inflamed joints. Dry or moist heat can help to prevent or relieve sore muscles. Over-the-counter OTCs. If rheumatoid arthritis pain and swelling are severe, consider OTC pain reliever like Advil to bring down the inflammation and reduce pain. Rest is the key to managing the flare-up of rheumatoid arthritis. Relax. Finding ways to relax can help ease mind and body as the body recovers. Next is to make healthy diet choices. Inflammation-producing foods like fried foods and processed foods and also junk foods can increase inflammation. And lastly is to call healthcare provider if symptoms of flare-up last longer than a few days or become severe. Let the healthcare provider know about it.
For the rheumatoid arthritis, drug therapy, we have the second-line medications, oral NSAIDs, more effective than first-line medications associated with risks such as gastrointestinal bleeding, cardiovascular event, and renal impairment. Use the lower effective dose for shortest duration possible. Next is corticosteroid injections. Provide a short-term relief for moderate to severe pain, especially in the osteoarthritis. Benefits typically last for weeks to a few months. Next is NSAID can be effective at relieving pain. At higher prescription dose, they can also help control inflammations. The MARS used in RA treatment including left-hand oral corticosteroid to reduce inflammation that can damage joints and organs, usually while you are waiting for slower acting disease-modifying drug to take effect. Is biologics used when traditional DMARDs fail. These target specific components of the immune system. Next is JAK inhibitors. These are oral option and work quickly but may have serious side effects. Analgesic, the pain reliever, acetaminophen can ease if you aren't available to take NSAIDs. It won't reduce inflammation. Last is corticosteroids. Similar to cortisone, your body makes naturally. Corticosteroid medication are potent anti-inflammatories. Prevention of infection, vaccination before or during treatment, infection screening before treatment, and hygiene and lifestyle like hand washing, mask use, avoid sick contact, good oral and general hygiene, medication use, minimize long-term corticosteroid, early detection, report fevers, cough, rashes, or UTIs immediately. For the supportive management, physical therapy, occupational therapy, patient education, psychosocial support, diet and nutrition, and assistive devices. For immobility percussion, why it matters. Prolonged immobility can worsen joint stiffness, muscle weakness, and increase the risk of complications like pressure sores and blood clots. Encourage regular movement. Position support. Prevent pressure injuries. Maintain joint function and circulation clear of complications. Early and consistent treatment. Use DMARS and biologic to control inflammation and slow disease progressions. Regular monitoring, routine labs, and imaging to catch complications earlier. And heart and lungs health, control your blood pressure, cholesterol, avoid smoking, screen for lung issue, and for bone protection, use calcium, vitamin D, weight-bearing exercise to prevent osteoporosis. For injection prevention, stay up to date on vaccines, monitor for infection, especially in immunosuppressants. Mental health support, address depressions, anxiety, and fatigue with support or counseling. For the rehabilitation, physical therapy, tailored exercise to improve strength, flexibility, and joint mobility. Occupational therapy teaches joint protection techniques and choose assistive device for daily tasks. Pain management include hot and cold therapy, TENS massage, and guided activity plan. And assistive device or orthotics, splint, braces, and ergonomic tools reduce joint strain and deformity risk. And patient education encourage self-management, pacing, and long-term adherence to treatment.